Hey, welcome to episode 3. Weather's been great this week. I decided to film a little early in the day, earlier anyway. Sun's still up, takes lighting a little bit easier for me. And yeah, I've just been enjoying the weather, sitting outside, um, writing some notes down, and yeah, so here we go. I'm going to expand on the last episode, um, where I kind of put it into parts. Where how did I get how did I get here, and take the first part of that with maybe defining some some terms, uh, then my thoughts on um, my alcoholism, sobriety. Again, I will put the links in the description for Recovery Elevator. I'm now an official member, um, and that's been going well. I signed up this morning. A lot of feedback, a lot of resources just right off the bat. Email, Facebook groups. You're put into a group that's capped at like 400 people, with an accountability specialist or person that um, you guys work together to um, just kind of define goals, and it's not just something internal to where your brain is always going to sign off and say, well, that's all right, you didn't get it. You actually have accountability to somebody else, which is great. I think it's like so key in in the uh, in the bigger aspect of being successful in sobriety. So I guess I'll start off by defining some terms. So I mentioned I was diagnosed with end-stage liver disease, as a result of alcohol-related cirrhosis. So cirrhosis, by definition, and this is just Google, all disclaimers. I don't want to rip anything off from anybody or get in any legal trouble, and I'll try and define it as it relates to me. So cirrhosis, a chronic disease of the liver, marked by degeneration of cells, inflammation, and fibrous thickening of the tissue. It's typically the result of alcoholism or hepatitis. So no hepatitis here. It was, straight alcoholism, and fibrous tissue is basically scar tissue. So it takes that part of the liver. In my understanding, it takes that part of the liver kind of out of commission. It's unable to perform its functions correctly or at all. So, and the liver is so important. Um, just right off the top of my head, it's close to like 400 functions of the body, filtering, managing protein, um, all things like that. We can get into more of that later, but that's the definition of cirrhosis. End-stage liver disease. Chronic liver failure, also called end-stage liver disease, or ESLD, progresses over months, years, or decades. Most often, chronic liver failure is the result of cirrhosis, a condition in which scar tissue replaces healthy liver tissue until the liver cannot function adequately. So, the cirrhosis brings on the liver disease, and end stage brings you to, where mine was. It wasn't a function or a matter of diet or medicine. It was just trying to keep it functioning as it was with the damage until I could get a transplant or a replacement. Peripheral neuropathy is something that I experienced, and it is I mean, it's awful. By definition, weakness, numbness, and pain from nerve damage, usually in the hands and feet. Common cause of peripheral neuropathy is diabetes, but it can also result from injuries, infections, or exposure to toxins. So exposure to toxins, probably my case, in that the liver wasn't able to filter proper toxins, and it causes nerve damage, especially in my feet. From my knees to my feet, but focused on my feet. And it's kind of like they're asleep, pins and needles, but all the time. And if they have any feeling, it's burning pain or freezing. And it goes on with the symptoms here. Include pain, pins and needles sensation, numbness, and weakness. And then it gets into treatments, and they sometimes use antidepressants, pain medication, anti-seizure medications, and then pain-relieving creams. But there and again, it's you want to treat the underlying condition that's causing the neuropathy, which is basically the liver disease. Cirrhosis leads to the neuropathy, the nerve damage, and the pain. So medications prescribed to me was gabapentin. It helped to some degree, but never fully got rid of it. And I don't know if I'll ever fully be rid of it. It's hard to tell right now because I am recovering from surgery, and I am on other medications that could be affecting it, but it feels better than before. So those are just some of the definitions and conditions and symptoms that I experienced up throughout and even before I was diagnosed. That probably was the first sign there was an issue, a few years ago, when I'd get up and take a shower, and I had this kind of tingly feeling in my feet, like they were falling asleep or just waking up, and it wouldn't go away. I'd forget about it, during the day and stuff, but when I was still or able to take my mind off other things, it was there. So some sort of indication that something in my body wasn't correct, yet I continued to go down the road of, numbing my, my other ailments and pain and things that I was dealing with in my life with alcohol. So I got some notes here, just changes that I've noticed. Pre-transplant, post-transplant. I am all of a sudden I'm a morning person. I've never been a morning person. Ask my parents, my friends, anybody. And I don't know if that's a function of I was always hungover or just, especially, after diagnosis and I was going through it with the liver disease, I was just completely lethargic, and I'd have sleep inversion where I couldn't sleep at night. I'd sleep half the day, and I just didn't have any, I didn't have any energy, and that's a function of all of it, but I didn't have any kind of drive or focus, and that leads me to drive versus apathy. And I've always been a pretty calm, chill person, impatient for material things and waiting, patient with people and situations, but my drive is just incredibly, it's just increased, and it's a great feeling. Both these things, popping up out of bed at 6 o'clock in the morning, no alarm, and grabbing my cup of coffee and listening to my podcasts and working on this project. and then the drive behind it. I It's just 180-degree just reversal from what it was. Um, I feel like I've become a little more assertive. I kind of went the route in my life of, sorry, it's windy out here, of the path of least resistance. Being an advocate of others, and not necessarily myself. And I've seen it in myself where I have become the most important person, and I'll use the analogy of, on the plane when you're in an emergency situation and the oxygen mask falls, they tell you to put it on yourself first and then help other people put theirs on. And I can totally see that with this, where I've always preached you got to take care of yourself first, or you got to take care of yourself so you can take care of other people, or you got to be right to do right. But never really practice it, and I didn't hold myself accountable, and that's how I got myself into this situation. So the assertiveness is kind of leads me to, like, I've always been a people pleaser. Now putting myself first. And there's a difference in types of selfishness, right? We can all be selfish brats and stubborn, but this is a different kind of selfishness. This is a mindful kind of selfishness, and I don't even know if you'd categorize it as selfishness, because in the greater vein, it is to do right by myself and other people, kind of the greater good. So, and that feels good to me. It feels good to put myself in a position to help other people instead of just trying to help people when I've got other things going on. So, all good stuff, all good things. These are the positives, right? I am happier. I'm grateful. I full of love. And you guys are, some of you out there are probably like, I can see the cynicism leaving his body. It's still there. I still have my sarcastic side, and life is still real. We still get in arguments and fights, and there's drama and stuff, but it doesn't quite carry the weight that it did before. So with all that being said, I just wanted to kind of drill down off of episode 2 to continue the journey in the aspect of having some background knowledge and some, we'll start kind of slow with the technical terms, and move forward from there. So, but just from my perspective, I'm glad to be here, and I'm hoping this is helping you guys. I mean, if you like it, that's great. Hit the like button. Please subscribe. If you think it'll help somebody, please forward. I've been throwing these out to Facebook, and with good response. Constructive criticism is always welcome. I want to get better at this. I realize it's a little raw, but like I said last time, as you guys give me feedback, we'll build this together. We'll build it in a way that is more and more functional every episode, and this can be a very big and great thing, and I'm so grateful, and thank you for watching.